Hi students, welcome to Module 9. This is the week where we start the conversation about medical interpreting. We're going to start very basic by going over some of the organizations that deal with medical interpreters here in California and also accreditation. What type of certifications do you need? We'll review a blooper and then I'll show you where to find what are some of the glossaries for medical interpreting that are available in the module and also go over your assignments. So this blooper was shared by a student from the Riverside Medical Center of Kaiser Permanente. So I would like for you to take a look at it and see. I can find two words that were not translated to Spanish, and then one word that is missing in accent, but there could be more. So help me review this, and if you find anything else, please feel free to share it in the general lounge about Module 1. And keep them coming. If you find something, especially from an organization or a big industry, in this case, this health system like Kaiser, I know they have their headquarters in Pasadena, and that's where they manage their interpreters and translators. So first, we're going to start going over what does HIPAA mean and how does that relate to interpreters, right? You probably have heard HIPAA, the Health Insurance Portability and Accountability Act. It was signed into law in 1996, but how does that relate to interpreters? So there's some links, please, especially if you're considering going into the medical interpreting field, download this presentation, download the documents that are found in this module so you can have them as resources. So here it says what are the certified languages, what should interpreters know about HIPAA, very important. And I'm going to make reference to some of the things that I pulled out from those links. So how does this relate to interpreters, right? And here it is asked, there's a question posed like, if you are either contracted as a 1099 or in-house, how did this relate to you? So must the covered health provider, even a clinic or a hospital, obtain an individual's authorization to use or disclose protected health information to an interpreter? So pay attention here, because this is going to be in a quiz, in a future upcoming quiz. The answer is no. When a covered entity uses an interpreter, right, to communicate with a patient, the individual authorization is not required when the provider meets the conditions below. Okay, so we're going to go over what conditions. They need to meet two conditions. Covered entities may use and disclose protected health information for treatment, payment, and healthcare operations without an individual's authorization. So this is again going, and it gives you here what law in California refers to that. So a covered health provider can use interpreters to communicate with patients who speak another language or sign language as well, deaf or hard of hearing. And then here it says, when using interpreter services, a covered entity, the clinic, the hospital, may use and disclose protected health information regarding the individual without that person's authorization as a healthcare operation in accordance with the privacy rule in the following ways. So this is the privacy rule, the one that I mentioned there. Again, if you're going to be going into medical interpreter, you need to know this. So there's two instances where you're covered. You're covered if you're a staff, an employee of that organization, either if it's part-time or full-time, it doesn't matter, or a volunteer of that organization. It could be a major healthcare system like Kaiser. It could be another hospital. So when the interpreter is a member of the covered entity's workforce, you're part of their workforce, right? Or pay attention, because this is some of you also do work as an independent contractor. So you get a 1099, or you might be doing remote interpreting, perhaps working with an organization or a company that provides phone remote interpreting for telehealth. When a covered entity engages the services of a person or entity, meaning another person that contracts you, who you're not a member of their workforce, okay? You are performing as an interpreter on their behalf as a business associate, as a contractor. And here it gives you the law. A covered entity may disclose protected health information as necessary, again, for processing payment, healthcare coverage, and to be treated as well to provide interpreter services on the covered entity behalf, and then it gives you the law. So this is referring the contractors, and this is if you're a full-time or part-time employee of that organization. Also very important, here it gives you another reference to the law. Very, very important that it says that the civil rights of 1964, that all organizations need to take reasonable steps, meaning to provide meaningful access to a person with limited English proficiency. This is a law. Even though we're in a tough political climate, this is still the law. Who will have contractual arrangements with private commercial companies, community-based organizations, or telephone interpreting services lines to provide such language services. If a cover entity has an ongoing contractual relationship with an interpreting agency, the service arrangement should comply with the privacy rule of business associate agreement requirements. Okay, so do hospitals are required to have interpreting services? Yes. So I want you to pay close attention to the discussion. It's from UCLA Interpreting Services, and start looking at different angles of what is provided, what is not provided. In the video, in the discussion, it's an amazing video. So it's really going to be a matter of reflecting as well. And here's the safety code again. I wanted to give you the law, the federal, at the federal level and at the state level. General acute care hospitals, okay, all our hospitals in California are required to submit to the California Department of Public Health on every year, okay, a copy of the policies and procedures that they follow for providing interpreting services to their patients. So this is kept on file with the Department of Public Health, and the Department of Public Health is very strict, very, very strict. I know because I was launching a healthcare program pathway at one of the schools where I work, and they're very, very strict. They mean business, so hospitals do comply with this. The hospital should submit their policies and procedure to their respective licensing and certification district office. So there, I wanted to give you as well more information in case you're thinking of volunteering or working as a staff or maybe as an independent contractor for a hospital. And here again, I reference more codes because especially if you want to go into medical interpreting, you need to know what you're covered and what does the law require of hospitals, which unfortunately many do not provide, right? But the law says that they need to provide. And here it just gives you the definition of what an interpreter should know according to the health and safety code, should know in order to be able to be an interpreter, right? They can accurately speak, read, and really interpret the necessary second language of the person, the target language, or a person who can accurately sign and read sign language. And then you should have the ability, right? Your skills to translate names of body parts. You're gonna find you're gonna be dealing with your glossaries, medical glossaries, where they go over medical parts. You're gonna have those in Spanish and English, body parts, and to describe competently, right, in an efficient way, symptoms and injuries in both languages. We're going to talk about malpractice and what has happened in major cases where the translation was done incorrectly and had horrible consequences. So pay attention to that as well. So here the interpreters may include members of the medical or professional staff as well. So here you're going to go to that to reference more. I don't want to go in the links, but please download the presentation. And especially, I know some of you are interested in the medical field, or even if you're just considering, have these resources available so that you know how you're protected by the different codes and laws nationwide and statewide. There's some very important organizations that I would like for you to check out. Here are their sites. Especially the California Healthcare Interpreting Association has amazing events and trainings. They have really good rates for students to join. They have annual conferences, so please make sure that you check them out. They also have a test, and I have posted that handbook for that certification in the module as well. So make sure that you check out all those links. And also very important that Again, I mention here some pages where it talks about the fees for that medical certification, and then a page to look out for. You are welcome to read it all, but these are certain pages where I think you're going to get a lot of information as to sample questions for the medical interpreting. And then I included, I'm constantly revising my presentations. I want students to have the most up-to-date resources. So this is the newer version of the National Board of Certification for Medical Interpreters. They revised this year in 2025, and please download it. It's also included in the module for, they have the candidate handbook with questions and how to prepare for the certification, and it's to prepare you. So please make sure you have that readily available. And again, if you want to become a medical interpreter, this is the way to go. And you're going to review and have more information as you move on into the program and the associate degree, and you take medical interpreting with Professor Strong or with any other faculty that might be teaching it. You're going to learn a lot about what are the requirements to become certified as a medical interpreter. The glossaries are very important. I posted some, even though there's nothing new. If you find something new, please let me know. I'm always looking for updated versions. But the ones that are out there are very, very, very valuable and very complete. I included the ones that are housed at Berkeley, the School of Public Health, and they did a collaboration with many organizations, and they have medical dictionaries in Spanish and English, so they're posted there. Also, please make sure you download the glossaries. I've included some there that are bilingual, and then I've included other links there for you to practice and learn medical terminology. For homework, for your homework for this module, very simple. I provided a questionnaire, a medical questionnaire in English, and then I provided that same questionnaire in Spanish. These are some forms from Central Valley in California that a student shared with me. So I wanted for you to look at them and see and compare what is it that you know. Look at the form in English, then open the form in Spanish, and you'll need to write 10 sentences for a medical intake. And please follow the instruction, only 10 sentences in Spanish and English. And I give you examples there, and then just upload it like you do always in your Word document. For the discussion, this is a great video by UCLA. Make sure you take notes. And I want this to be a very lively discussion. Tell me what do you think of what's happening? Do you see it happening with your own family members? Maybe would they be at a hospital, or do you know of situations of this sort? Because they do role play and they show the do's and don'ts of interpreting when it comes to interpreting at very delicate situations of medical conditions, right? So very lively, engaging, please, respectful conversations in your discussion. Just a reminder, put your name in all your Word docs. I have a lot of students. I have 3 sessions to 3 to 4 classes per semester. So just make sure that you put your name in your assignment. When you're writing, put your name on the first page so I know who is the assignment that I'm reading. Make sure you do your name, and then put, if it's a homework, if it's a class exercise. Even though the class is asynchronous, I give homework, and I also title some of the assignments to distinguish them, homework and class exercises. For the calendar, again, the deadlines, please review them. There's deadlines that, especially for the quizzes, I give you the study guides way ahead of time so that you prepare. There's no surprises. So there are some quizzes coming up. Make sure that you know those deadlines. And the announcements are very important because when the college shares news with me, and I know they send them to students as well. Sometimes students do not open their emails on time, so I'm always trying to see what is out there, what opportunities. So make sure that you also have the ability, if you want to post in the student lounge or in the Pronto app if you know of any internship or of any opportunities for other students. But in the announcements, please listen to the audio, because in the audio, it's an opportunity for me every week to remind you of like key things that are happening. Maybe there's a quiz coming up. So I listen to the audio, just get into the habit of listening to those audios that I post in the announcement section. And if you're in the desktop version, you can find it right away in the homepage. but also you can see them in on your phone or your iPad if you have a smart device where you downloaded your Canvas app. So this concludes the video lecture. Again, very basic, just wanting for you to really look into those organizations and the certifications that are available and what are the laws that protect medical interpreters. So I hope you enjoy this module, and next module we'll be dealing with medical terminology and very, very important colloquial words. So I will see you next week. Thank you.